recording with me?
I will consent to recording with you. What we're doing this?
We're recording at the
Or
moment. This
is
is
this our
the
intro or
why
why are
not?
you doing this?
Well,
Okay.
I'm just sort of trying to get into the swing of
All
things,
right,
right?
Paul.
We're gonna
I
call
consent
this.
to you recording with me. I'm going to just record more and more with you until you tell me to stop.
Oh, I
That's
can talk
my
for basically forever. Some say it's my greatest skill, and the
no.
reason that they deeply dislike me.
I meant my backwards consent framework, where I'm just gonna like
Oh,
keep talking to you on
okay.
recording, and then if you become uncomfortable, I expect that you'll say something.
Fair enough. You reserve the right to retroactively remove your consent.
Right. Oh yeah, absolutely.
Quite a
That
sensible legal
that's
provision,
key.
in my opinion. In any case, let us call this podcast 0 of the inaugural Maths v Meds podcast. Although I do want to register my, I don't know, discomfort with the framing of verses because we're more with each other than opposed to one another. But as you mentioned, conflict drives traffic, and we're a traffic horse.
Yeah.
Or aspiring traffic horse, I suppose. So let's at first credentialize ourselves. So why don't you go ahead and introduce yourself, doctor?
Oh, I'm Matt Strauss. I'm a critical care doctor. That means life support. And I'm also an assistant professor at Queen's University in Canada.
And my name is Paul Verbeek. I'm a professor of mathematics and computer science at the University of Toronto at Mississauga. So I suppose that at least credentializes to talk about some medicine and some math, wouldn't you say?
One hopes.
One hopes. Although we're not on the CNN or the TVs. So perhaps.
No, I was on Russia
actually,
Today.
Was that a television show?
Yeah, it was cable news. I was like a talking
Wow.
head on cable news, which has been a
So
long
you're
standing.
fake news officially. You're a Russian asset.
Yeah.
That's deeply unfortunate.
I definitely wondered about it, and I had a little bit of reluctance, quite frankly. I would have preferred to have been on some non-Russian media first, but
Well, baby steps. Well, why don't we work backwards from there? Why were you on the state media in Russia?
I don't even know, Paul. It could have been catfishing, as far as I'm aware. No, I've been writing these pieces for The Spectator. They've been critical of the steps Western governments have been taking to get a handle on this coronavirus business. And I think it was Russia Today, UK, which is a weird thing to be, a Russian state broadcaster in a foreign country. So I think it is going to end up being a little bit counterculture no matter what it does. And my voice on this is a little bit out of lockstep with prevailing narratives. So I think that's why I was asked on.
So what can you tell us about the status of the Russian lockdown and what their prevailing narrative is?
Oh, the Russian lockdown? No, I meant the UK lockdown. I don't know.
Oh, you
I don't
were
know very much
speaking
about the
on Russian TV about the UK lockdown.
Well, no, it was Russia Today, UK. They have.
I see now.
Just like BBC America. It's like that.
Right. I see. Okay. So you're speaking about the UK lockdown. So what can you tell us of the extent of the UK lockdown and what the sort of majority opinion there is and how you're dissenting from it?
I think the lockdown there more or less resembles what we have here. It might be a little bit more stringent in some respects. So I was hearing these terrible stories of the police using drones to like catch people walking too long in the park. And I think in Wales, it was illegal to exercise more than once a day until yesterday.
Well, strictly speaking, we have the police drones here in Oakville, Ontario.
I did not know that.
They didn't ultimately come into the park. I imagine they were just trying to see if we were congregating with one another. But I do also suspect that they would have come into the park if we were doing so. Let me tell you, it was deeply unsettling to walk through a Canadian park with police drones hovering ominously above us.
It's so strange how this varies from municipality to municipality. I saw the barricaded High Park in Toronto to prevent people from looking at the cherry blossoms, which just looked ridiculous. They did it up like a crime scene. But here in Kingston, there's very little to prevent you from going into a park.
Well, it should definitely be made illegal to enjoy the cherry blossoms in order to stop the spread of COVID. Is that a sort of correct assessment of the situation?
Okay, all right. So obviously it's not, no. So there's been almost no documented cases of transmission of COVID outside.
Zero documented cases.
No. There's been a couple. I said almost none. There's 4 million cases of COVID that have been documented. I understand there's been very few. Now, most of the cases of COVID, we don't know where they got it from. They're community spread. So it could be that it's from outside, but generally this is not how the virus transmits.
And how would you detect if someone caught it outside versus inside?
Oh, in terms of contact tracing. So if there was only 2 cases in your community and then you were the third, and they said when were you with John Smith and when was he coughing in your face? And if you said under the cherry blossoms at High Park, that would be documented as an outside transmission, but there are precious few of these.
Okay. So let's continue talking about this COVID crisis. We've come together in order to speak about this specifically. I suppose to get off on the right foot, we should just sort of state our opinion of this matter. You have a medical opinion. I'll have a sort of statistical and modeling opinion. So what is your medical assessment of COVID, its fatality, the way the media has been framing its severity? And perhaps that's enough to start with.
Yeah, that's a very large question. So COVID is worse than the flu. Interlocutors who were saying that it's just the flu, they were wrong. It's going to kill way more people than the flu has since 1918, or maybe since 1950s. But it is primarily killing elderly people. This is the really important fundamental thing about COVID that is just not discussed enough. We have to tailor our strategy to the disease that we're currently dealing with. So in Canada, 82% of the COVID deaths have been in nursing homes. That has not been where we've been focusing our efforts on lockdown, transmission, treatment, tracing, etc.
Would you say we've done a good job protecting our elderly?
That's a humongous question, but no. And I've been on the lookout for well-documented medical case reports of anyone under 50 with no comorbidities dying of COVID, and I haven't found any. I have found 2 news reports, both out of the UK of relatively young people, but the thing about news reports and what makes them different from medical case reports is the news reporters do not have access to the medical records. So if the reporter asks the bereaved family, did they have any medical problems, and the family says no, that's it. That's the extent of that. So I don't necessarily believe that we can say there have been documented medical cases of anyone under 50 with no comorbidities dying of coronavirus. So that said, I think that we need to have a tailored lockdown or a tailored quarantine approach where we protect the people who are actually vulnerable. Right now, we're locking everyone down when more than 2/3 of them are not actually susceptible to death by COVID.
As far as you know, has there been any other time in history where we've quarantined the healthy in order to protect the sick?
I'm not a historian. I understand that all sorts of people were doing all sorts of things during the bubonic plague in medieval Europe. So some people were going to their villa and not coming out.
Okay, fair enough. I'll rephrase the question. In terms of a medical procedure or prescription to some disease, does locking everyone inside, including the healthy, make sense?
I'm not aware of this ever having been done. And I know in the 1950s, there was an Asian flu that killed lots and lots and lots of people. And almost no social distancing was practiced in that case, as far as I'm aware.
So why do you suppose our government is locking us inside as a reaction to this disease?
So it's effective. It is effective in decreasing the number of the cases in the population. What I'm arguing is the cases that matter are people over 50 by and large. So I'm not going to say that the lockdown isn't in that sense effective, but there are risks and benefits to any treatment that anyone proposes, and the lockdown is kind of a public health treatment. So people know about chemotherapy. Maybe it'll take your cancer away, but it'll knock the shit out of you. And I think the lockdown, because we're not targeting the vulnerable population, I think that the cost to our mental health and our health more generally and quality of life is at this point quite substantial and not it's too much to accept the measures that we're currently under.
So this quarantine is kind of like a chemo for COVID, like a chemo on society almost.
Yeah.
Okay, but chemo sucks, right? As a
Yeah,
treatment for like.
Yeah, and the thing about chemo is we don't force anyone to take it. Like you discuss the risks and benefits, and then you can either take it with the knowledge that it's going to knock the stuffing out of you. And by the way, the kind of colloquial vision of chemo is a little bit outdated. There are more targeted therapies for cancers now that have much more tolerable side effect profiles. But the chemotherapies used to target just any cells in your body that were rapidly dividing. That's why your hair would fall out and you'd get terrible nausea, vomiting, and diarrhea, because the lining of your gut was also rapidly dividing. Or why you might become infertile, because gametes, sperm and ova, are rapidly dividing.
You spoke earlier about comorbidities. Would you mind expanding on what a comorbidity is and how it's relevant in this context?
Yeah, it's another medical problem. And the thing to be careful about, particularly when reading these news reports saying that somebody had no comorbidities, is some relatively minor medical problems seem to be important as far as COVID is concerned. So obesity is one. And you don't have to be so obese. When I say obesity, people think of morbid obesity. But I, for instance, would have to gain about 35 pounds to be obese. It just means BMI over 30. It's not very much to be obese. So there are many, many, many Americans under 50 who are obese, and that seems to be a significant risk factor. And then asthma, even minor asthma, seems to be a significant risk factor.
Okay, so if I were to come into the hospital with leukemia,
okay,
and I contract COVID and die, how is this listed? Is this a COVID death?
So in Canada, I can't speak worldwide. I fill out death certificates in Canada, and a huge amount of it is left to the discretion. In fact, almost all of it is left to the discretion of the person filling out the death certificate, which is usually the physician who was on call the night that you died. So when I do it, I just sit and think: did he die of leukemia and the COVID just kind of pushed him over the edge? Or did he have a really bad case of COVID and he was a little bit more susceptible to it because he had leukemia? This is more art than science. It's literally more art than science.
So how do you determine if someone has COVID? What are the symptoms and what are the available tests we have at our disposal at the moment?
The list of possible symptoms is ever growing. And I don't know if this is going to be good news for hypochondriacs or bad news, depending how you look at it. Loss of taste and smell is one. Otherwise, it's just the usual upper respiratory tract infection symptoms. So fever, feeling unwell, cough, nausea, vomiting. There can be more, but it generally, a headache, it generally would feel like something between flu and cold. And for young people, many of them are completely asymptomatic and wouldn't know that they have it.
So why then are we feeling like this is some type of killer disease if many people...
It is for people over 50. It's, I think I should maybe have the charts handy, but I think if you're in the 50 to 60 age range, it gets to be like 1.4% mortality, which is not nothing. If I ask you to pick a number between 1 and 100, if you pick wrong, I'm going to shoot you. That you wouldn't play that game. That's not a fun game. In your 80s, it's more like 13%, which is humongous. So yeah, I absolutely think this is a bad disease that could kill a lot of elderly people.
This brings me to an important point about the statistics of this, and perhaps now I'll start playing more foil than interviewer. Are you describing the IFR or the CFR?
CFR.
Okay, so this is This is a huge distinction that has to be made, and I think everyone basically thinks the CFR is the IFR.
Okay, fair. So, I mean, I am aware of the distinction. You can draw it out for viewers if you like.
CFR and IFR, something that I myself didn't even know about until this whole thing started.
Well,
CFR...
They should be the same. If we had perfect science, they would be the same. So,
but they're not even close, right?
Yeah,
CFR is always going to be much higher than the IFR.
Yes.
And let me just explain them so people can follow along. Okay, so the CFR is something called the case fatality rate, and the IFR is something called the infection fatality rate or infectious fatality rate. You can correct me.
Infection.
Okay, infection fatality rate. It's best explained using an example. So suppose 10 people have, there are 10 people in a population, and 5 of them get COVID. Of those 5 who get COVID, 2 get COVID so bad that they present to the hospital. And of the 2 who present to the hospital, 1 dies. The case fatality rate, the fatality rate of cases presenting to the hospital is 1 in 2, or 50%. The infection fatality rate, that is the number of people who die, who get infected, who ultimately die, is 1 in 5 in this case, or 20%. Right, so this is very important, right? When you say a 1 in 100 chance of dying of COVID, you are exclusively talking about the proportion of population who got COVID so bad, right, that they had to come to the hospital. That is not to say that if you're above 50 and contract COVID, your chance of dying is 1 in 100. Your chance of dying, if it gets so bad enough that you present to hospital, is 1 in 100.
Sure. Yeah.
Okay, but like this distinction is incredibly important. This is why people are overestimating the severity of this disease.
Okay, but I don't know by how much is the thing. Like this is the problem, that the IFR is an unmeasured number. By definition, it's unmeasured.
Right. But some of the randomized testing that has already occurred typically demonstrate that 20 to 30% of the population have already contracted the disease. In fact,
I haven't seen numbers that high. Where?
Well, one was a small population size 500 in a small village in Germany. I don't know the particular numbers coming out of this Kent County case.
Yeah,
give me 20% then, right?
So the numbers I've been seeing have been like 15 to 20%. And I tweeted about that German village. I think it was called Ghent, maybe.
I suspect it's between 20 and 30% of us have already had it.
Oh, I don't know about us.
That's where my money is, right?
I mean, California definitely had more of a caseload than us. So there's the famous Santa Clarita study, which was heavily criticized. There was the German study. But California and Germany definitely got COVID worse than us. Like in Kingston, where I live, there are 0 cases in the hospital right now. And precious few, like 3 or 4 in the whole region of hundreds of thousands of people.
Well, some of the, like we are now detecting that this disease may have been with us since December. And if it's infectious, as we think it was going to spread. Well, everything is guessing at this point.
Yes.
Right? So
yes.
I am making educated
guesses
from models. Right? So if it's been around since December, and because either you have to accept that it is very infectious or not very infectious. Right. So at the moment, I think most people would think that it's a very infectious disease. I think they would also say that it's airborne, somewhat mistakenly, but debatable.
That is a debatable point, and the debate mostly seems to be a matter of nomenclature, so not actually that interesting to debate.
Well, I think the news is doing an incredibly bad job of describing any of these things.
Sure, that's fair.
Right? So, like, I was basically outraged when I found out that IFR and CFR were being conflated in the media. Or when they're doing things
like saying, the editor?
Hey, well, no, what's the point, right? Like, look at this cumulative growth function. Look at it go up. Right? Like, that cumulative growth functions, by the way, literally cannot decrease. Right? They are cumulative. So let's talk about the media a little bit then. Given that they've whipped us all into this frenzy, hospital admissions have dropped by a lot. Right? At least from what I'm reading in London. And at the moment, our hospitals in Ontario are only at 75% capacity, whereas last year they were at 92% capacity. Right. Around 90% capacity is where we want to be, right? Anything else would be a total misallocation of resources. You don't want hospitals half empty. I'm not going to go build a mega hospital in Nicollet, right?
Yeah, I mean, I don't know what the answer is for, like, on a normal day during a normal time, not in a pandemic. I don't know what the ideal occupancy rate is. Like, you want to have some wiggle room.
1 in 4 beds unoccupied seems high
during a pandemic. Absolutely.
Well, during any time, right?
It's a risk benefit or a cost benefit analysis that you have to be doing. So yeah, if it's the summer of 2017 and we have all these empty beds, maybe it's not actually costing that much. Like, you have to keep the lights on, or you don't. You just flip the light switches off. If you're shutting down the whole economy under the rationale that we're doing it to preserve hospital capacity, and you have 1 in 4 beds empty, then the costs are astronomical. And I understand the rationale for flattening the curve, but if you flattened it so much that you're far under hospital capacity, then
we flattened it too much. Like, I sort of chuckle to myself because like there's like a standard joke about calculus, like, when will I ever need to use an integral? And it's like this exact moment. This exact moment, it's actually critical that you understand what an integral is taking. Right? It's the area under the curve, right? It's going to be the same amount of area no matter how we stretch it. I think people are under the misconception that we're actually saving people by doing this.
Well,
we're simply
unless you could stretch
delaying
it so long. Unless you could stretch it so long that you had a vaccine or an important treatment that saved lives, like
surely more people would die than COVID would have killed under that circumstance.
Right. Yes, I agree.
Right, which is something we can discuss later because people don't seem to understand the unintended consequences of this. Right, the totally predictable unintended consequences of the things that we are doing. All right, so going back to that, the purpose of the original lockdown, the 2-week lockdown, was in order to give you physicians and hospitals some time to prepare, right? So that the spike, right, a very high peak, could be flattened, right? But still, it's the same amount of mountain, so to speak, right? So still the same. Like we're the whole strategy at the same time was to prevent deaths due to hospital overfilling, right?
Yes.
But never to lower the amount of deaths caused by COVID.
Yes.
Okay, I don't think people understand this either, right? Because now we find ourselves in a situation where it's 0 deaths is one too many, which is a preposterous starting point, right? Under those conditions, we should lock ourselves in closets and like never ever leave.
I agree completely. All I can do is clap emojis. Yes.
Should I talk like this the rest of the podcast? No, but like, this is why I'm so disappointed with the media. Like, these aren't like, okay, these are maybe a little bit sophisticated ideas, but these are certainly ideas that anyone with a university degree who went through their first year will have to learn. Anyone who took calculus should be able to understand this.
Yeah, that's not most university students, but yes.
Well, it's a great proportion of university students.
I don't even know if that's true anymore. I mean, not a university.
That's a different subject. People can surely understand adding things, right? Which is ultimately all we're doing.
Yes.
Because like I have other issues. Like maybe we can go back to this thing where you said this is definitely not the flu, right? Because you can only say that like with some sort of dubious assumptions about how the rest of the pandemic is going to play out. We currently haven't exceeded maximum flu deaths, right? With COVID deaths. Like I found it incredibly difficult to find any information on flu deaths, right? Because apparently no one is ever counting them. We only ever estimate how many people die, which was amazing to me. Which I don't understand then how they're saying this isn't the flu if we don't have the data to compare it with to begin with. But they say it lies somewhere between 2,000 and 8,000, where currently I think we have under 5,000 COVID deaths. Right. So at the moment, we cannot say that this has been more severe than the flu. We can only say that it hit harder, perhaps, or faster. Right. But we haven't killed more people than the flu can kill in a bad flu year.
Okay, yeah, but the flu has a year, whereas
yes, under
Canada,
the assumption that things carry out this way, yes. But if it's infectious as we think, and it's already infected like most of the population, we're like talking about approaching herd immunity levels. And from this point on, like actually protecting the at-risk group, like will be effective. Like we can potentially from this point on have herd immunity plus the knowledge of the at-risk group. So we could potentially get no more deaths or very few.
I don't think 15 to 20% will get you there. Even 20 to 30%, I don't think will get you there. Like based on the R naught value, like the reproductive number.
Well, hold on. It's R naught and as critically the period of time you're infected. Right? You can half R naught and double the time you're infected and get the same results, right? So this is something the media is also sort of missing.
Or infectious, rather.
Oh, sorry, infectious, right? Guys, I'm good at math, but words aren't my thing.
Yeah.
I apologize. But thankfully, I have someone smart here to correct me. So what is the infectious period? Do we know?
Well, not exactly. Like we're
what's our
flying
like?
by,
Okay, so but like
maybe
ultimately,
as long as
something is being plugged in. This is the thing that's driving me up the goddamn wall.
right.
Right? Everyone's like, we don't know. I'm like, ultimately, you have put something into the models. Like,
Right.
you can't put I don't know into a computer. Right? You have put something into the models. Tell me what those numbers are. I want to know.
So 3 weeks would probably be most people's estimate for how long you're sick.
That's impossible because ourself, like if you come into the country, they quarantine you for 2 weeks. So if they thought it was 3 weeks, they wouldn't make quarantines 2 weeks.
Oh, okay. I mean, I have had COVID patients test positive 3 weeks later, personally myself.
So then this is just evidence that the 2 weeks like quarantine is pointless. Or is this because you're going to exhibit symptoms within those 2 weeks?
I think it's partly, yeah. It depends. I think the idea being that you're probably, the incubation period is probably about 5 days where you're asymptomatic.
Okay.
So I think if you, I'm not sure what every public health authority is doing, but I think
I
it might
don't
be
care
like
about
2
every
weeks
public
from
health
the last
authority.
time
Like,
you were.
we can
Might be
speak
2 weeks from the last time you were symptomatic or something like that.
No, if you fly into Canada, you have to isolate for 2 weeks. Right?
Okay.
And I'm suggesting that you've just told me that we're assuming that you can be infectious for up to 3, and there's like asymptomatic people, right?
Yeah,
Thus rendering this quarantine totally pointless.
I assume
Right? Or
you
at least
have
the
to
2 week one.
say. I assume you have to say if you're getting sick during those 2 weeks, not the stay-at-home quarantine.
But you could potentially be asymptomatic and carry it for a following week, right after your 2 week quarantine.
Yeah, you could. I mean,
and a lot of people are asymptomatic.
Yeah, I think they know this, but they're figuring they're going to get 95% of the cases.
Okay, so that's my issue number 1. Right, dear government, why aren't you telling me these numbers? Right? Issue number 2, why aren't you sharing your models so like the academic class can verify them to make sure that you're like not making coding errors, which is very typical. Right, we usually have to put all of these pieces of code through like code review, peer review, like regression testing. I don't trust the state scientists are doing things properly, especially given that the models have been incredibly like wrong up to this point. Right?
Yeah, the models have a terrible track record. That much I can agree with. It is strange that they're not making it open access. I wonder if there's privacy considerations.
With what? Counting the number of deaths? Right? I do not accept, like, if this is like, my God, right? If they would say that there are privacy issues regarding this while simultaneously stripping us of all of our rights and freedoms for like 105 days, that would be such a preposterous, like I would go through
all right. Okay, it came to mind, Paul. Like it came to mind.
Well, that's another point. Are all of us aware that our like rights and freedoms have been curtailed for like 108 days for like totally dubious reasons? And like it seems that the government has this ability to restrict our rights for whatever reasons whenever they want indefinitely. Like this is what it means to live in a Western democracy, right? Freedom and democracy when we like feel it's convenient. Like if we feel you're endangered and too stupid to like follow simple directives, we're going to lock you inside.
House arrest. Yeah.
Well, this is effectively house arrest. That's a nice one. At least we get to go to the grocery store and stuff like this. But I can't currently enjoy the park at the end of my road legally.
Yeah, it's upsetting. I mean, I think I knew for a long time that public health had these sorts of powers that like you actually, now that's not for well people, but for sick people. So like if you had tuberculosis anytime for the last 100 years, Canada could send you to a sanatorium where you would wait out having tuberculosis. It was not unlike prison.
But at least in that case, they were doing that to the sick.
Yeah.
This is comparable to sending like random healthy people to the sanatorium.
I agree. I guess I'm not as upset about it because it just doesn't surprise me. And because I think our fundamental freedoms, so you and I having this podcast, me criticizing the government, so long as I'm still allowed to do that, they're not allowed to do that in China. Or else the Wuhan police arrest you in the middle of the night.
Yeah, I suppose like our state isn't preventing this, but if we contravene anything that the World Health Organization is saying and put this on YouTube, it's going to be taken down. In fact, we won't be able to share this on Facebook if we contravene the World Health Organization's directives on this, which have been incredibly like misguided to say the least.
Which directives have been incredibly misguided?
From the World
what
Health
I,
Organization, like when
yeah,
they
yeah.
said there was like no human to human transmission of the virus, China like totally promised pinky swear. Like a World Health
That's a
Organization
good one.
official
That's a
not
good
being
one,
able
Paul.
to say Taiwan, right? Or whatever
Well,
the
that's not a directive. He didn't direct everyone else to not say Taiwan.
That's fine, but the first one was a big fuck up.
Yeah, and again, it's still not a directive. It was an inaccuracy.
Well, it's not a directive to get your shit prepared. There's a wave coming and we don't know what it is. It's a don't worry about it, right? Like maybe worry about your bats. Do you guys have bats? Then you should be fine.
Yeah, no. So I'm upset about the liberty issues. Maybe just not as upset as you, because it just it doesn't.
No. Let me like make this
what's
very clear.
stranger to me
When they said let's shelter in place for 2 weeks, we don't know what's happening. We need some time to prepare. We need to like as they were saying, flatten the curve. I'm like totally sensible. We don't know what this is. Let's quarantine for 2 weeks. Then 2 weeks became 3 weeks. 3 weeks became 4. 4 weeks became close to 8 now. I never agreed to 8 weeks. Like 2 weeks made sense to me. Like what I want to know is why are we still in quarantine? We have flattened the curve too effectively, right? To the point where we're now actually doing damage to the healthcare system.
Yeah. So to underline your point, I get an email every morning about how many ICU beds there are and how many are occupied in Ontario.
Okay.
And we've been at, on average, less than half of our surge capacity the whole time. And
why were we ever getting
and we
messaging?
peaked 3 weeks ago, and it's only been going down since then. So I don't know
So
how flat we're trying to make this curve.
But I have people who are like adamant with me, adamant that our hospitals are being overrun at the moment.
Nope.
Well, why does
so there may
think
be
this, then?
right. There may be a pocket issue, right? There may be a couple hospitals in the GTA that are truthfully overwhelmed.
Okay.
Based on demographics or just based on, I don't know what the statistical term for it is, but just some places got hit harder all at the same time. Some places have a lot more elderly folks who are obese, let's say. But no, in general, hospitals are not overwhelmed in Ontario.
Okay,
period.
but like we have this perception and it didn't come out of nowhere.
Right. I think
like every day I hear like radio messages going out to our like frontline healthcare workers, like stick in there, guys, like keep going. You can handle it.
And I do appreciate those.
But you're half empty, right?
Right. Well, no. So
there's some truth about these like TikTok videos of all like entire nursing wards doing coordinated dances, right?
Yeah.
At first, I was like, give these nurses a break. Like they have hard jobs. And my nursing wife pointed out to me that it's preposterous that a whole ward would ever have time to simultaneously perform a coordinated dance. That the only way that they could ever do this if the ward was empty. Right. So, right. Well, would you agree or disagree with it?
No, I agree. That's true. It's like it was eerily quiet, particularly for the first couple of weeks, and there were concerns about whether people who really should have been coming to the hospital stopped.
Yes,
and also
people having heart attacks, right, are no longer coming to the hospital.
Who knows? Who knows?
Well, unless like staying in places helping people have less heart attacks, maybe.
Well, they certainly have less car accidents, less motorcycle accidents. And I think if you have nothing to do but take your medicines, maybe you're a little bit more likely.
But that's a great point, right? Like cars kill a whole ton of people every year.
So 30,000 Americans every year die.
Okay, but like how many Canadians, right? Like I want to get out of Canadian quarantine. I don't care about
2,000. About 2,000.
Okay, so 2,000. Yeah, 2,000 people a year die in car accidents. That's like 6 a day. I'm sure if they like gave like the names of everyone who died in a car accident every day on the news, made a huge like deal out of it. Could we ever like just make cars illegal then? Like would people like I can make the exact same argument, right? 0 deaths are too many. This is too risky of a behavior. It's worse than COVID because it's indiscriminate in its execution of its victims, right? It's not old people, it's young people, it's important people and children, right? So why, like, in terms of a risk assessment, why are we in quarantine? Try to make it like this. Trying to make a case for the government, right? I'm trying to steel man their argument.
So we still don't have textbooks about this disease. One might even say with the H1N1 pandemic that it was still the flu. it was still a deadly flu, and we've seen deadly flus before. Every year we have deadly flu, so we kind of knew how it was going to behave. I think some amount of the panic was justified by the fact that we didn't know what this was. We didn't know how it was going to behave. We didn't know if you might be contagious for 6 weeks after, or whether you might be able to get it again. These sorts of doomsday scenarios.
So we sat in place for 2 weeks, and we gathered information. And for some odd reason, we didn't do any randomized testing because I don't know reasons, right? Because the Canadian Health Organization has to verify all of this stuff in a proper bureaucratic manner, right? Everyone has to get their stamp on it.
Sure. Yeah, there's a lot of that.
What is your feeling of Dr. Tam? Is she doing a good job?
I honestly don't spend a lot of time watching those press briefings. I don't I know on some issues where I've disagreed with her, I have found her rationale not convincing. So one being that I'm a proponent of herd immunity, that if we could get the 2/3 of the Canadian population under 50 to be infected and get over their coronavirus, then the pandemic would probably stop.
And just to clarify why you're saying that, Dr. Tam suggested that herd immunity is not an option for Canada, despite it being like a natural immunity that has carried humanity along until now.
Until just now, yeah.
Until just now, but no longer a valid solution for the modern pandemic.
Right, and we could go more in depth into her particular comments, but they were basically that we don't know if there will be immunity to COVID-19 after you clear COVID-19, because not enough people have cleared COVID-19 to know whether they're going to get it again the second time around, and if there is immunity, how long that will last.
So you're telling us that even once you get the disease, you can contract it again?
Well, I'm saying that was her rationale, and my counter argument is that there have been 4 million cases. There have maybe been, again, a handful of purported cases of people contracting it again, but it was more likely that they had a positive test than a false negative than another positive. But also, it just seems to me like David Hume's problem of induction, that just because the sun rose every morning for the last several billion mornings you can't prove that the sun's going to rise tomorrow. So even just because every time we've cleared every other self-limited viral infection, the average patient does have immunity thereafter for a significant amount of time, that doesn't prove that'll be the case with COVID-19, because we've never had COVID-19 before, but it just is to be reasonably expected that we will have immunity after you get it.
Mm-hmm. If not, well, yeah. So we may actually be doing damage by not allowing the population to develop herd immunity while staying inside.
No, we certainly are doing damage. Like we don't have an economy to have an economy so that we can all put numbers in bank accounts to feel good about ourselves. That's not why we have an economy. We have an economy because all of these things need doing. Like you need to have plumbing, and you need to have roofing, and you need to have highway maintenance, and all of these things that we've shut down, you can't just suspend them indefinitely. And every day that we keep them suspended is a cost, and part of that cost will be measured in human lives, undoubtedly.
Yeah, but like, I suppose I understand why people are made uncomfortable by the fact that we're going to have to make these calculations involving human death against money, right? But the economy crashing is also going to kill people. Right, so ultimately,
did I not say that?
No, I'm just like sort of reaffirming what you're saying, and saying like, look, people. Ultimately, we're making a calculation about lives, right? And if it's my father, then it's no longer a statistic. That's a person, right? But from like a macro level, my father is like a statistic, right? So I understand like how this is both personal, but like something we also have to like take a step back from and see from like a population level thing, right? Because I can't insist that the whole world stays indoors to protect my dad, right? I understand that.
But you don't even have to, is a thing. Your dad can stay indoors to protect your dad. This is the part that makes no sense, is that why do we have to lock down everyone to protect people who could on their own choose to be locked down? Like if you're a 22-year-old college student living in a house with 3 other 22-year-old college students, why do you have to socially isolate from each other Well, I guess you wouldn't because you're in the same household, but whatever.
Yeah, but
You're
like,
not.
you know what the real tragedy here? Do you know what the quarantine like forced? Like, what happened? They took all of those 20-year-olds who would otherwise be healthy and
Yes,
communicate
and
the
sent them
disease among
home.
themselves and sent them home to infect their grandparents and their parents.
Yeah, it's ridiculous.
Like, so I
But
hope people
your
understand
dad.
how much damage some of these idiotic decisions we have made. And we should and did come up with pandemic plans with a more level head, and we're not following any of our pandemic plans. Go read the pandemic plan. What we're supposed to be doing in this exact situation is like quite sensible. It's like, I don't know, like maybe isolate the at-risk group and sort of practice more hygiene measures. Right. But we don't get to like isolate the population to like level 5, which is like catastrophic propagation of killer disease.
It would be hard to see what we would be doing differently if this was an Ebola pandemic, right? Which has 100% mortality rate and is airborne.
Yeah, and it's COVID is not that. Right. And I would say almost like the media is acting like it is that.
Okay, but we're getting back to your point about the personal versus the statistical. My
I'm
point
just saying
is,
it like,
you can make it personal on both sides. That if your dad or yourself or your brother or your sister is out of work, watch what's happening to them. It's not good.
deaths of despair are a thing, and we're already predicting deaths of despair in the tens of thousands.
Mm.
Right. I think U.S. is certainly going to be 100,000 deaths of despair. But I think we don't have a solid appreciation for what like a supply line is or what the economy is. Right. It's not this like abstraction of like moving money around. Right. Like people think food comes from the grocery store. No, food comes from the ground or from farmers, right, who have to farm it and prepare it and put it on trucks, which get driven across the country to be packed, right, to be put on shelves by
And those
people
trucks
for you to
need
buy.
fuel, and those trucks need repairs, and those roads need to be serviced, et cetera, et cetera.
It's
And
a
somebody's got
delicate
to be
balance.
making the electricity for the power plant to have the refrigerators run in the grocery store, and it gives me a headache just thinking about it all.
Yeah, and like so far, we haven't really had supply line issues. The supply line issues that we did get were from like unprecedented surges in demand for things that there would normally never be, like toilet paper and bread flour and stuff like this. But otherwise, there's still meat on the shelves. Like we're still getting milk, we're still getting eggs. I don't think we really have suffered truly from supply lines. But when it comes down, it's going to come down fast. Like in the UK, there are already people who can't serve hamburgers, and I know that sounds almost petty, but like if McDonald's can't serve you a hamburger, start panicking. Right, supply lines are coming down. Right, that's like the canary in the coal mine. So for now,
I see no reason why. I see no
hamburgers.
reason why that would get worse from this point, though.
Okay, but if we don't boot back up the economy, right, the whole thing can't survive on borrowed money. Like we're surely running out of money. Like the farmers asked for a bailout from the government, and the government offered 250 million, which seems woefully inadequate, right, to bail out a multi-billion-dollar industry.
There's still I don't quite understand why farmers would need help, because they're farming the food, they're transporting the food,
Well,
they're putting it in grocery stores. For
one, they can't get pickers. Okay, we just talked about how like these supply lines are delicate. They want like the meat packing plants have apparently been epicenters in Canada, and they want them all closed. Side note, like all the packers are Filipinos, and they're kind of like, stop being racist to Filipinos, which I kind of find funny. But if those packing plants
for
go
our
down,
listeners, Paul is half Filipino.
I'm allowed to do whatever Filipino jokes I care to do. If those packing plants go down, there goes the meat supply line. Then the farmers have to kill all of their animals because they can't sell the meat, and then they're
sure. So that hasn't happened yet.
It has happened that those meat plants are shutting down.
Okay,
I'm just saying, right? Supply lines are going to start failing soon. Well, maybe not soon, but they will start failing. Certainly by September. Certainly by the time we develop a vaccine, if that is even feasible. Because I'll remind people who are listening that we've been trying to make vaccines for like a bunch of diseases for like a really long time. Right? We still don't have HIV vaccines or tuberculosis vaccines.
There's a tuberculosis vaccine. It's just not very good.
Okay. But we have no HIV vaccine.
I have a scar from it.
Oh, do you really? HIV vaccine? I remember that party. It was fun.
TBS.
Oh, out of context, that's going to sound really bad, but I'm just going to leave it there.
Sure. I'm Tucker.
Okay, so are you done?
Oh, well, it's 10 o'clock.
Okay, I'll see what we did. Like, I think that was mostly unusable. We took us a long time to warm up, but when we got warmed up, it was okay. So let's try again on Monday. Get your microphone.
And I'll be not up 2 nights in a row.
You now have a better idea of like how I'm going to interrogate you.
Yeah. No,
right.
That's terrific.
Which I think maybe the title is appropriate there.
Math questions, Matt.
No, math be mad because I'm like, that's bullshit. You're lying with numbers. Okay, so yeah, that was okay. I'll give it a solid B.
I feel I'm just really, really tired, I think, unfortunately. And I blame my dog's bowels.
Yeah. Poor Merkel diarrhea. Okay, so yeah, go get your thing in Guelph. Thank you. Talk to you later.
Au revoir.
I
wonder if I closed caption that.